So we continue to have 44 people who've tested positive for COVID-19 across our region. And for those of you who've been watching the data, we haven't seen new cases now for the last couple of days. We currently have no patients who have tested positive for COVID-19 in our intensive care unit or in our hospitals, but I can say that we have got a reasonable number of patients with severe respiratory illness in our hospitals awaiting COVID diagnoses and testing results. What we have seen through Australians' very proactive action before the disease surges out into the community is making a difference, and we can see it here in the Murrumbidgee region. We have actually seen a slowing of the transmission of the COVID virus, but I want to really talk today about what that means. What it doesn't mean is that the COVID virus is controlled and gone away. It hasn't. It is still here, and we cannot afford to be complacent. What we have seen through our social distancing and our broad-scale testing is a slowing of the transmission of the COVID virus across our region. I really want to thank the people of the Murrumbidgee region for their actions over Easter. And I'm sure we'll hear from Superintendent Noble later, but from what I saw, people were absolutely fantastic in their compliance with staying at home, focusing on not gathering in public, and really that focus on hygiene. Only going to food shopping or out for medical supplies. Thank you very much to all the people right across our region. But there's actually one more thing I really need to ask you to do. We're a rural community. You want something done? Ask a rural community. Reason why? We care about each other. The one thing I want to get us to all think about is getting more people tested. It's so important now. It's the bit that we need to really focus on. We're very fortunate in New South Wales that they have broadened the testing criteria. What that means for you is if you have a cough, if you have a sore throat, a runny nose or a fever, you can come forward now and be tested for the coronavirus. This is the most critical thing, and the reason is this. If we can test people early, we can trace their contacts. People are actually asymptomatic for about 4 days before they come down with symptoms. While they're asymptomatic, they are highly contagious, and that's where we see community transmission. We've seen it in parts of Australia now. We should be concerned. We've seen it in Tasmania. We've seen hotspots in parts of Sydney. So let's not get hotspots. Let's get out and get tested. We're going to help you get tested. As well as the testing centres that we already have established, we're going to have mobile testing, where we'll go around the regions. We're asking you not to travel, so we're bringing testing to you. And we'll have all our information about that up on our website soon. So there's so much that we can do. We can test. We can get people traced. We can ask people to go into isolation, and that will slow the transmission across our community. We need to remember COVID-19 has not gone from the Murrumbidgee region. We have just slowed the transmission, and there is much more that we can do. We're also using this very, very precious time, I call it the golden time in our hospitals. We're using it to train our staff because we know the people who are the highest risk. We really want to focus our testing on people over the age of 65. We want to focus our testing on people who've got weakened immunity. We really need to get ready for those people. Again, 81% of people have mild to moderate symptoms, but the other group of people we know will become severely ill. And in our hospitals right now, we are continuing that training in what I call this golden hour. We will get a surge of very sick people coming to our region, and I just want to reassure everybody in the Murrumbidgee region that we will be ready. You saw us undertaking recruitment campaigns in recent weeks. It's been fantastic. The response has been amazing. Thank you to all those people out there. We've had 40 people come forward saying thanks heaps, we want to help. And finally, just some really good news. New South Wales Pathology have advised me that by the end of the week we will be able to do accelerated testing here in Wagga Wagga for severely ill patients. That's really fantastic news for Wagga Wagga, and we need to use that resource, that precious resource, very wisely. And again, we have a specialist COVID respiratory team of doctors who are leading up our response, and they're really delighted to hear that news today. So with that, I'll hand over now to Superintendent Noble for his update this morning. Thank you.